Which of the following is the most appropriate next step in management? Antidepressant, follow-up, psychotherapy, hospital. 30-year-old woman presents to her primary care after 1 week of giving birth to her second child. She was feeling emotional, having mood swings, about to cry, baby, harm. Thought any harm is unremarkable. I would schedule a follow-up because it's only been a week. It's probably postpartum blues, and we'll see if it goes to depression or not.
Yeah, good. So this is a key thing, right? You want to keep a close eye on these mothers, right? That have postpartum blues, which can happen with under 2 weeks, right? But of course, let's change kind of. I think you got the weeks down, of course, right? And so of course you want to see them again, make sure they don't have postpartum depression. Which if they do, then you want to start an antidepressant. But let's kind of switch it. Let's say the vignette or the problem says that after birth, she is having thoughts about harming her baby, right? And she is not acting like herself. Um, and she can't sleep, things like that. What do you want to do then?
Uh, if she has, if it's what, like, if she has thoughts of harming baby, then that's postpartum psychosis.
Yep.
And I, when they start, well, first of all, when they start harming the baby, I don't know if you refer them to psychotherapy. No, you admit them probably and have to keep an eye on them, right?
Yep, exactly. So you're going to want to do something a little bit more aggressive, right? Admitting them, consulting psychiatry, right, and probably starting some antipsychotics, right? So I'm just giving you different scenarios, right? It's just kind of think about when you're thinking about like these differential diagnoses, these problems, things like that. Especially in OBGYN, especially on a psych standpoint, you're really thinking about postpartum blues, postpartum psychosis, and postpartum depression, right? So those are your three that you constantly have to think about in each together, right, to be able to pick the right answer.
When they say like consult psych, does that mean like the psych guy will, it's only when you need them, but does that mean they come in that same day?
Oh, are you talking
Or
about on the test, or are you talking about in real life?
I didn't know there was a difference. So
Well, I mean, ideally, right? I mean, okay, so ideally, I mean, everything is run differently, right? At each hospital, but if something is acute, then likely the consulting service should come see that patient ASAP, right? Of course, if it's just kind of like giving you example, right? Let's say in OBGYN, patient comes to you 3 weeks with postpartum depression. Do you need a consult psychiatry? Or do you want to initiate antidepressant therapy first?
you want to initiate it.
Yeah, you want to initiate because it should be within the realm of practice, right? Like an SSRI, primary cares can give it, right? OBGYNs should be able to give it too, right? And of course, you can always refer them after to psychiatry, but it's not an acute thing. You get the difference, what I'm trying to say?
I think so, but like for the book purposes, if they consult someone, are they supposed to like come that day, or does it just mean that they're gonna see that person
Yeah,
within?
they're gonna just see that person. Just assume that. So the questions that they also always ask about referral is I feel as though it's always like they ask you what's the next step in management is when one of those answer choices exist. Um, Usually I would say that if the treatment answer is part of the answer choice, that's going to always be your answer choice. Does it make sense what I'm trying to say?
Say that one more time. If the
So
what?
if the answer to treat the issue that's going on is an answer choice, that's going to be the answer choice.
Yeah.
If that treatment option is not there, but the referring service is, that's going to be the answer. If that makes sense. So for instance, if this question was postpartum depression and they said initiate antidepressant versus referral to psychiatry, then obviously it's initiate antidepressant. If it doesn't have initiate antidepressants but just has referral to psychiatry, then referral to psychiatry would be answered. So
Yeah.
don't really think about it about a timing standpoint because they're not gonna, it's not gonna be about, oh, are they seeing them right now or are they seeing them later, if that makes sense for
Okay.
book purposes.
Okay.